Good morning. My name is Meryl Moss, and I'm the Chief Operating Officer at Coastal Medical, and thank you so much for joining us. I'd like to recognize in particular Elizabeth Roberts, and I knew where she was. Oh, there she is. Thank you. She's hiding, but you can stand up. Secretary of the Rhode Island Executive Office of Health and Human Services, thank you for being here and joining us today. We've appreciated all your work. And Dr. Kathleen Hittner, our Health Insurance Commissioner, thank you as well. We're honored to have an outstanding group of speakers and panelists. Joining Dr. Caros are United States Senator Sheldon Whitehouse and Dr. Don Berwick, President Emeritus and Senior Fellow at the Institute for Healthcare Improvement. Our panel will include Peter Andruszkiewicz, President and CEO of Blue Cross Blue Shield of Rhode Island, Jenny Hayhurst, Vice President of Network Management at United Healthcare New England, and Dr. David Brumley, Senior Medical Director at Tufts Health Plan. Dr. Caros and Senator Whitehouse and Dr. Berwick will speak first, and then we'll bring our panel up. We've prepared one question for them, and so we'll be asking the question to our panel, and then I'll be opening up to the audience in general. So let us begin by my introducing Dr. Caros. Dr. Caros practiced primary care internal medicine in East Providence for 20 years and has been Coastal's president and CEO since 2008. So,
wow. Thank you, everybody, for being here. Good morning. We're here today to talk about healthcare transformation and payment reform. And usually we begin these conversations by talking about our aspirations for the future. But today's going to be different, because today we're actually going to begin by talking about real performance data with regard to the cost and quality of care delivered at Coastal Medical in 2014. And I think the numbers, if you will, tell a clear and compelling story. They tell a story of progressive excellence in quality of care. They tell a story of new and better experience of care for patients. And they really tell a story of a new kind of partnership with payers, with CMS, with Blue Cross Blue Shield of Rhode Island, with United Healthcare, and with Tufts Health Plan, each of whom have worked with us to improve quality, to offer new and better services to patients, and to help us to lower the total cost of care. And we also have a unique and compelling story, I think, to tell about jobs creation and workforce development here in Rhode Island. So Coastal Medical exists to serve patients. Patients always come first. So we're going to begin by talking about quality. Coastal is a participant in the Medicare Shared Savings Program. We're one of 333 ACOs across the country in the Medicare Shared Savings Program. And I guess I should stop and recognize the fact that we actually have one of the architects of the Medicare Shared Savings Program here with us today. Maya, if you could just stand up, I'd like to recognize you as an honored guest. So there are 333 ACOs in the program, and each ACO is required to submit on 33 quality measures to CMS. And then CMS gives us an aggregate quality score. And I'm excited to announce today that Coastal's quality score in 2014 was in the top 1% in the country amongst those 333 ACOs. So that's indeed a gratifying outcome, and actually we've had very similar results in our work on quality with all of the commercial payers who are represented here today as well. So it's important to recognize that quality performance is really a shared accomplishment, right? There's so many people who contribute to it: the doctors, the medical assistants, the nurse care managers, the clinical pharmacists. And there's also now in our new model, there's data analysts, and there's a quality team, and the office managers play an important role. And of course, CMS as a partner was very important. But I think it's important to stop and remember that ultimately this is an accomplishment by the patients, right? Any physician can tell you that if you have a diabetic patient whose blood sugar is out of control, that problem's not going to get solved by the decree of a physician, right? And it's not even going to get solved necessarily by the good work of a nurse care manager or a diabetes educator. What has to happen is that fundamentally the patient has to make a deliberate decision that they're going to engage with their healthcare team and that they're going to do a better job of managing their own health. And so that's really where the magic occurs in all of this quality improvement work, is when patients themselves make that kind of decision. So that was the first part of the story we wanted to tell today, that we were in the top 1% in quality. The second part of the story is equally important, I think, and I want to convey that in our work with Medicare, with Blue Cross, with United, with Tufts, we were able last year to save a total of $15.3 million in the total cost of care for these populations of patients. And what that means is that compared to what the expected cost would have been for those populations, the actual cost was $15.3 million less. And at a time when rising costs of healthcare are such an important challenge in our state and in our country, that seems like an accomplishment that's worth examining a little bit, and to consider what might be able to be learned from Coastal's experience and perhaps generalized to others. And I guess at the heart of this work is this notion of delivering the right care in the right place at the right time. And just that single phrase, I think, really captures much of the work that we've been able to do to impact cost. So that's the second part of our story. We saved $15.3 million last year in total cost of care. So the third part of the story is this unique and compelling story about jobs creation. Since the beginning of 2014, we've created 151 new unique jobs at Coastal Medical. And most of the people who've been hired into those positions are performing in roles that simply didn't exist before the beginning of 2014. So before 2014, we didn't have a centralized prescription refill team at Coastal Medical. We didn't have a quality assistant team. We didn't have a transitions of care team. We didn't have a home visit team. We didn't have a Medicare annual wellness visit team. So all these new teams and all these new folks have been trained to become part of what I would call a new kind of healthcare workforce, right? And this new kind of healthcare workforce is supporting what we call the primary care office of the future at Coastal. And so our vision for that is still evolving, but I think we've seen enough already to be able to say that we understand that this new workforce can help our providers and our office staff to be able to deliver a higher quality of care, a better patient experience of care, and ultimately more cost-efficient care, a lower cost of care. So that's the third part of our story. We have this new healthcare workforce that's active supporting our patient-centered medical homes. The fourth part of the story is an important one too, and that's the fact that we're highly focused on the experience of our providers, of our healthcare teams, and our staff. We recognize that even today, despite the changes that we've been able to bring about, that our providers are spending too much time on tasks other than direct patient care. And so we're working hard to fix that. We're looking once again at how we use the electronic medical record, certainly a big issue for providers. We're also utilizing team-based care and centralized clinical programs to lighten the load some for providers in the offices. But we still have a lot of work to do, and we know that burnout in primary care is a very well-recognized and pervasive problem in our industry. And so we've made the professional satisfaction of our physicians and our advanced practitioners one of our highest strategic priorities. And at the same time, we recognize too that really every employee in the company touches the experience of care for patients. And so for the second year in a row, our board of directors at Coastal decided that when we got ready to make a shared savings bonus distribution, that every employee of our company would be included in that distribution. Because our board understood that what we're now calling population health management is really a team sport. And while all the members of our clinical teams are crucial, we also know that it matters, and everybody in this room knows it matters, right? It matters how you're greeted by the receptionist when you walk into a medical office. It matters how somebody answers the phone when you're calling trying to get an urgent visit because you're having a problem. And it matters how the whole team and all the staff help patients to address and solve problems in between the times when the patient is actually in the office. So what we did 2 weeks ago, our executive team visited every coastal practice. We met with every coastal employee. We shared this exciting news about top 1% in quality. That's a shared accomplishment. Everybody was thrilled about that. But we also went out to recognize the important individual contribution that each person makes to that patient experience of care, and to deliver a bonus check, which makes that commitment that we have real, our commitment to those, every one of those employees, and our recognition of their contribution. The last piece of our story here is that patients at Coastal are seeing a level of service that most of them have never seen before. We have a Coastal 365 clinic that provides an urgent primary care visit 365 days a year, Saturdays, Sundays, holidays, weeknights. We have nurse care managers working in our offices with patients, working in the hospitals with patients, working in the nursing home with patients, and calling patients frequently at home. Our patients can have their blood drawn in the morning. They can log on to the patient portal and get the results that night, and they can use the portal to send a question to their care team and have it answered. Our patients who take opiate medications benefit from a standardized program we have now with oversight by our clinical pharmacy team, so that we know that the safety and appropriateness of the use of those medications is assured. We also we have diabetes management programs centrally, and we offer diabetes education classes, 130 classes a year now, which is a big expansion for us and a great resource for our patients. A month ago, working with Blue Cross, we rolled out a new program where one of our nurse practitioners can do a home visit for a subset of patients with multiple chronic medical illnesses. And 2 weeks from now, we're going live with new disease management programs for patients with congestive heart failure and COPD. So this is sort of a continuous process, right? This work is always ongoing. But we wanted to sort of stop and take a moment here. We put this event together today because we wanted to bring some of the details of this experience into the public conversation here in Rhode Island about care transformation and payment reform. And we wanted to, we have to acknowledge that we still have a long way to go. We know in particular at Coastal that we want to put more emphasis on integration with specialty providers and with hospital providers. But at the same time, we recognize this is really a pivotal moment in Rhode Island right now. There's a lot happening. Governor Raimondo has convened the Working Group on Healthcare Innovation and has charged us to make a recommendation about a global healthcare spending cap. The state's been the recipient of a $20 million state innovation model test grant from the federal government. And there are committees hard at work trying to determine how can we make best use of that resource. The Office of the Health Insurance Commissioner has convened 2 large committees that are formulating recommendations to the Commissioner about future regulation with regard to care transformation and payment reform. And the Rhode Island Quality Institute has just received 4 major federal grants, which are going to be important resources for the advancement of the work in the state. So this seemed like a timely moment for all of us to come together, for us at Coastal to share a bit of information, but for all of us here to really be able to exchange ideas about the future of healthcare in our state and in our nation. Now it's my pleasure to introduce Senator Sheldon Whitehouse. Senator Whitehouse has made healthcare reform a hallmark of his distinguished career in the United States Senate. He's been a particular champion of investment in health information technology and the passage of the Affordable Care Act. I think his efforts to fix our broken healthcare system have probably been an inspiration for lots of the people in this room. They certainly have been for me. And so I hope you'll join me in extending the warmest welcome to Senator Sheldon Whitehouse.
Thank you, Al. This is an extremely, extremely happy day for me, and I want to congratulate Al and the Coastal team for all that they have accomplished, and welcome Don Berwick, who is sort of the Yoda cum Obi-Wan Kenobi of delivery system reform here to Rhode Island. I have to admit that I'm a geek when I get incredibly excited to quote, I wrote it down, to quote Al, healthcare transformation and payment reform. You know, most people would keel over when they heard that, but I think in this room we know how important that is. And I'm really grateful to be here. It's kind of a day of threes. 333 providers around the country, self-selected, so it's a competitive group, to go for this. And in that most competitive self-selected group, measured against 33 quality measures, this Rhode Island outfit came in 3. 3 in the country out of all of that. So it's a really, really proud Rhode Island day, and there's this wonderful graph that shows where they are right up here in the sweet spot where cost and quality intersect at the best place. And why this is important, first of all, it's just really cool every time Rhode Island does something great, and this is that. But there are 2 other graphs that this brings to mind that I think you've all seen. One is why this is so important, and that's the OECD graph that shows all the industrialized countries that we compete with, and it's got more or less the same metrics. It's got quality up one side, cost across the other, and it's got a similar cloud of the real competitors here. The embarrassing thing about that graph is that the United States of America is somewhere by itself way down here, competing with Croatia for quality, and 50% worse than Switzerland or Holland, who switch off being the most expensive per capita folks we compete with. I mean, it's outrageous that we're out there. And the question how we get back on that graph is answered by how we got here on this graph. And in between those two comes the Dartmouth Atlas, which shows how spread across different states the outcomes are, and it measures quality there as well against cost. If you look at Medicare cost, the average in the country is about $10,000 per recipient per year. Some states have pushed it down below $8,000. Other states are bumping up against $12,000 per year. That's a huge range. And if we can move the $12,000 states down towards the $8,000 states, that would be a good thing. And the interesting piece is when you look at the quality care delivered, it's not better in the $12,000 states. It's better on average in the $8,000 states. So this is our opportunity. And for those of us who have fussed at this from a policy point of view for a long time, sitting there looking up at the sky and dreaming of flight, to see Coastal actually get up in the air and produce these kinds of results while making their clients way happier and more satisfied. What a day. Very proud to be a part of it. Congratulations, Al and Merrill and the whole Coastal team. But if you don't mind me quoting from a woman who I have an enormous amount of respect for, it takes a village. It takes a village to make this happen. Wouldn't happen without the support of Blue Cross. Wouldn't happen without the support of the Quality Institute. Wouldn't happen without the support of the state and the whole group coming together to help move this all along. So I wake up frightened that one day I'm going to look around and just like the banking industry, all the CEOs in healthcare will be gone in Rhode Island. We'll have been eaten up by some other state. We'll still have the tellers, but all the big jobs, all the lawyers, all the accountants, all the CEOs, gone out of the state, which happened to us in my lifetime here in Rhode Island. If we keep doing this kind of stuff, we don't have to worry about that. It'll be our neighbors who have to worry about us going there, and that's a happy situation. So congratulations, everyone. This is a really, really, really cool day. Oh, I get the pleasure of introducing Don. I've had such a great time with Don, first of all, in his time at CMS, and we've also had back channels on this for many, many years. So I guess I couldn't say more than that in the delivery system reform movement, and it is a movement, the patron saint, the Obi-Wan, the main Yoda, the guy who has been doing this for such a long time and really gets it and has worked hard to build the stuff in Washington to make these things happen. Don Berwick, thank you for being here.
Thanks, Senator. Thanks, Al. I really appreciate the chance to talk with you. Lower your expectations after that introduction. I just want to take a few minutes to zoom out a little bit and put what Coastal is doing in context. It's a privilege to be here to get to celebrate with you. And the point I want to make is this is not just of importance to Coastal or Rhode Island. This is national. In fact, it's internationally important work. I don't want to increase the burden on your shoulders, but I'm going to tell you the truth. Senator Whitehouse laid out very efficiently the problem we're facing in our country. Healthcare, it's not doing its job. It's an enormous difficulty itself within and creating difficulty in the country at large. You can think of it, I guess, as three challenges. One is to make healthcare a human right. We're the only nation, the only developed nation on earth in which healthcare is not a human right. And the Affordable Care Act takes a step toward that. It's not complete. There's 50 million people without coverage. If we implemented the whole Affordable Care Act, that would be 30 or 32 million people, leaving out 18, but it's a step. The second problem, though, is the care you get when you're in the system doesn't match the needs of the public. We kind of built a system that's very strong on technocratic, miracle-producing medicine, but doesn't meet the social need. Since the social need has shifted toward chronic illness, mental health needs, a tremendous untapped opportunity for preventing illness in the first place. So we have defects in the care. And the third is the cost. And it's Senator Whitehouse said it right. We're nearly 50% more than the next most expensive countries. There's a slide we were sharing with Senator you've seen before that the Commonwealth Fund produced that said if we were number 2 in the world, if we were Switzerland instead of the U.S. for 30 years of cost, we would have spent $15.5 trillion less as a nation on health care than we actually did, just by being number 2 in cost. $15.5 trillion is enough to send 175 million people to college free. It would be justified if we were producing more value with that, but Switzerland is number 2 in the world in ratings of health system performance by the World Health Organization. We're number 27. Our longevity is 40th in the world. Switzerland's number 2. It's not value. We know the waste levels. They've been well studied. I myself did a study in 2012 with Rand Corporation showing 34% of the $3 trillion we spent in our estimate isn't buying value for anybody. It's harmful. Therefore, those of us interested in change, you and I, want to make a difference. The name of the difference that the Institute for Healthcare Improvement supplied in 2007 was the triple aim: better care, better health, and lower cost at the same time. Better care, better health, lower cost, all together at the same time. Lower cost through improvement, not withholding. The stakes are very high. I got a close look, as you may know. After I ran Medicare and Medicaid, I came back to Massachusetts and ran for governor. And I didn't win. I'm not governor. Although I've been saying lately I did win. I just turned it down. But it was really something to come to see the state as a system of systems, and the growth of the healthcare problem has hurt the society way outside the healthcare scene. In Massachusetts, parks and recreation budget is down 25% in 15 years. Local aid's down 40%. Higher ed support's down 30%. There's only one item on the state budget that is up in 15 years. It's healthcare. It's up 72% in constant dollars. It's confiscation. It's public resource moving to healthcare from other very needy sectors. And on the private side, it's the same. If you're a CEO of a corporation, it's the same kind of movement of opportunity from other things to healthcare. We're not bad. We're noble, but we haven't got it right. And so the question is how to change. There's a lot one can do in setting the context properly. I got to write the reg for the accountable care organizations with Mai and others. I could see what we could do with policy and payment, moving the context. But it isn't about moving the context. The actual need for change isn't what I call outside-in change. It's not a bunch of rule makers writing new rules and regs and payment schemes and incentives and accountabilities. You can have a toxic or favorable environment, but that's not where the work gets done. The work doesn't get done outside in. It gets done inside out. It's the people who give care and the communities they serve together they're the only possibility for actually building the new system. The new system, we know what it looks like. That is, the good news is if you search the world, as I do and Al and others, we know what the care looks like that would meet the social need, the triple aim, better care, better health, and lower costs. We know how to deal with chronic illness. We really do. We understand the potential of prevention. We know how to activate people to help become healthier themselves. We know how to be partners with our patients, but we haven't done it. We can. We know what that care system looks like. The question is, can we navigate there? It's a bear. It is really hard. The first wave we tried back 20 years ago was managed care, which was trying really to manipulate outside in to get the insurance systems to work to support management. It didn't work. It lost faith with the public because it became management of money, not management of well-being and health. But if we who give care take responsibility for seeking the triple aim, we can do it. It can be done. The ACA helps, the Affordable Care Act helps set in place some contextual opportunities like the one you're seizing with the ACO world. But the bigger job here is thorough redesign. It's really hard, and I want to acknowledge you in Coastal because I know how hard it is. I understand what you've been grappling with. The payment system isn't yet aligned properly. It's moving in that direction, but it's nowhere near where it needs to be. The delivery behaviors in the hospital sector and the different segments we built, they're not totally supportive of the kind of person-centered, home-based, continuous, health-oriented care that we need. And I know it's hard. And I know that the behavior change is hard. I was talking with your board chair, Dr. Fried, and he was celebrating the idea that we can link the change to the local practice. That's a mentality change. That has to do with thinking about being different kinds of clinicians, much more team-oriented, much more together in pursuit of it, but it's hard work. Your success is stunningly important. In the Institute for Healthcare Improvement, where I'm back now as senior fellow, we're putting together a coalition around the country called the Leadership Alliance of 40 organizations. You're one. Coastal's in it. Thank you, Al, for joining. But we're going to work on radical redesign. We're going to keep working on the design principles that will actually allow the triple aim to emerge in the results that you're achieving. The design principles are the ones you're talking about within Coastal. Change the balance of power. Move care into a much more team-based frame and involve the patient and community more thoroughly. Use telemedicine and telehealth. We say move knowledge, not people. We can free ourselves from the shackles of admissions and visits and encounters into the much more mature world of moving knowledge and capability everywhere, every way we possibly can. It's honoring individuals. It's customizing care to the needs of every single person. Maureen Bizigliano, the CEO of IHI, now talks about changing the question from what's the matter to you to what matters to you. And that's a different frame of mind when we meet the public that we serve as our partners. It's refocusing on health and wellness, and it is definitely focusing on joy and work. There is no way on earth we can get to the triple aim with a demoralized healthcare workforce. It cannot happen. And so Al's intuitions and your board's intuitions to celebrate together and to build the sense of cohesiveness and return to the joy you feel in your work is so much more important than getting the carrots and sticks in the right places. That's not going to get us where we need to go. And return the money. It isn't a success in healthcare if we don't end up in a place where the proportion of GDP that America is putting wages laborers take home in their pocket and the competitiveness of businesses and the ability to fund the roads and schools and programs of social justice and equality that we want get the money they need to do their work. And that's part of the job, and that's why this is it's more than healthcare that should celebrate these results. So your success really matters. For better or worse, now you're being watched. You know, if Cleveland Clinic or Geisinger or Mayo does something really cool, as to use the senator's term, it's cool. But it's not proof of concept because they're so distinctively odd. And in fact, frankly, they're not leading anymore. But when you do it, a recognizable communitarian, community-based, real delivery system with the kind of people I've met and get to work with in Coastal do it, it'll build confidence and morale and possibility all over this country, and to make it even harder, all over the world, because we're not the only country struggling with this. So your example is a really, really important one. One more piece of advice, then I'll shut up. It's a roller coaster, not a not a sled ride. There's going to be hard times. I'm sure you've had them already. The day will come when you won't be able to put up a number that you really are proud of. The rule makers are going to write a rule that suddenly throws you a curveball that hurts you. Stick it out. Stick with it. This is about really getting a job done over time. So be proud. Be confident. Build a future. Doing this from the inside out, from those of us who really care, that's what's going to actually deliver the nation's change, the change the nation needs. So congratulations. It's really a pleasure to get to work with you, and I'm not going to stop working with you. I really love it. Thanks a lot.
Thank you so much. So now we're going to ask our panel to come up and to sit. We are going to begin by actually asking the health insurers a question, but I'd like to introduce them properly. First, we have Peter Andruszkiewicz from Blue Cross. He's been the president and CEO of Blue Cross and Blue Shield of Rhode Island, the state's largest health insurer, since 2011. He's worked in the health insurance industry for more than 3 decades, and he's recognized as a champion of change and innovation in the field. Jenny Ahurst, in her current role as Vice President of Network Management, ensures that United Healthcare members have access to affordable, high-quality care delivered through a national network of physicians, healthcare professionals, hospitals, and other care facilities. And Dr. David Brumley, Senior Medical Director at Tufts Health Plan, is a board-certified family physician with many years of managed care, clinical, and consulting experience. He has served as Senior Medical Director at Tufts Health Plan since January 2011 and was previously at Blue Cross Blue Shield of Rhode Island and Blue Cross Blue Shield of Massachusetts. So welcome. The first question we actually have prepared, and I'd like Mr. Andruszkiewicz if you could answer that first. And this is the question. Can you comment on how your organization views the results of your work with Coastal, and share your thoughts about next steps in healthcare transformation and payment reform in Rhode Island?
Absolutely. Thank you, Meryl, and thanks for having me today. I'm flattered to be here and to celebrate the results that Coastal's achieved. It is remarkable, as Dr. Berwick said, especially in a place like Rhode Island, I'll talk about this in a second, that is so fragmented, to have these kind of results. It's remarkable. Coastal's been one of the Blue Cross Blue Shield Rhode Island's deepest provider partnerships over the past 7 or 8 years. Coastal, we had our first shared savings agreement with Coastal. Coastal was one of the pioneers in putting pharmacists, behavioral health specialists, population health registries is the latest thing that Coastal's working with Blue Cross Blue Shield on to enable population health. So we applaud the innovation, the population health initiatives, the consumer-centric nature of what Coastal's done, and we applaud the ability to see the change through. Dr. Berg, we talked about this as well. I worked at Kaiser Permanente prior to coming here, and I know how hard it is. I think we all know how hard it is to change. It's particularly hard to change, systems that have been in place for as long as they have, and it's particularly hard to change paradigms that both the patient and the provider have learned to understand and to change to something that's so different. But these results, which are astounding, is a reflection of a new patient-centered, consumer-centered model that Coastal has built, and it's remarkable and it's wonderful. It's a great example in the community. Blue Cross Blue Shield's Rhode Island strategy is affordable, simple healthcare for Rhode Island, and we're doing that by working with providers like Coastal who are ready to move beyond fee-for-service. And we're putting our resources and our people and our talent against those providers like Coastal who are ready to go to this new place. Problem is we don't know where it is yet. So when we talk about next steps, where we go from here, Meryl, I think it's important for us to describe, we have a point of view, Blue Cross does, about the future of healthcare. First and foremost, we believe the future of healthcare is team-based care. Coastal's a good example of this, but primary care can't do it on its own. Neither can the hospitals do it on its own, neither can Blue Cross do it on its own, neither can the state of Rhode Island do it on its own. What it's going to take is to move away from this collection of fragmented healthcare services and healthcare providers that we have, that we call a system, which I would argue is not a system at all. My favorite definition of system is a set of interrelated parts organized to solve a complex problem that no one part could solve on its own. And if the problem we're trying to solve is community and individual health, we don't have a system today. What Coastal is beginning to build looks more like a system. It'll look even more like a system when we start to have clinical and financial linkage of primary care, hospitals, subspecialists, and others to facilitate and accelerate this population health that everybody's talking about. So Blue Cross is committed to, our strategic plan with our board says we're committed to getting to a place where fee-for-service is gone by 2018. And the level of cost escalation in the community looks more like CPI than 2 to 3 times CPI, which has been for the last 30 years. The way that we believe that needs to happen is through innovation and disruption. But it's not against the providers, it's with the providers. That's our new business model. Our business model used to be to beat down providers on unit cost and utilization. Today, it's working with providers to figure out how we can work together, helping them innovate, be as disruptive as we can without breaking the system, but getting to a better place. Things like evidence-based medicine, health registries, EHR connectivity, e-visits, telemedicine, all the things that are happening both in care delivery and in payment structure and payment innovation in the future is where I think we're going. Thanks for having me.
Thank you. Jenny?
Hi, thank you for inviting me here today. United Healthcare is impressed by the work Coastal has done, their dedication, and is very happy to be here today to celebrate their successes and what you've achieved in your accountable care transformation. It has been really positive to work with Coastal as a partner in those efforts, and I'm very happy to be here to, as I said, applaud their successes. In United Healthcare's accountable care agreement, Coastal has scored in the 90th percentile or higher in most of the quality measures that we include in those programs. In fact, in 3 measures, colorectal cancer screening, diabetic A1C testing, and well child visits, Coastal is #1 for United Healthcare's ACOs, for those ACOs that have been in our program for over 18 months.
Did you say in the country?
I did.
Good prompt, Merle.
We also have seen some improvement in total cost of care and lowering total cost of care, most notably in our Medicare ACO. And that's been very positive. One of the most rewarding aspects in working with Coastal is something Al mentioned, their team approach, and how we view ourselves as their partner in these efforts as well. As far as next steps in healthcare transformation in Rhode Island, I think these exciting results energize us in the work that we need to do together in this state. And as indicative as it is nationwide, it's the case here in Rhode Island, where we're moving away from fee-for-service and really towards programs that reward for delivery system transformation and deliver the triple aim, so lower cost, better quality, better outcomes. And United Healthcare is excited to be part of that work in the state. We think it has real tangible value to our consumers, and that means a lot for what we're trying to do here.
Thank you.
Thank you.
Dr. Brumley?
Well, thanks very much to Dr. Carouse and Coastal for inviting me here today. It's for convening this panel and being such thoughtful leaders in healthcare in Rhode Island. And I'd also like to thank Senator Whitehouse for all his efforts in healthcare reform, and to Dr. Berwick for being an inspiration to me personally, and to countless others as we pursued the triple aim. Tufts really appreciates the opportunity to be on such a distinguished panel. So first, I'd like to acknowledge all the great work that's gone on in the state to put such a robust structure in place. There's been enormous and very good quality work by the Care Transformation Collaborative, work on the SIM grant team, and by the Rhode Island Quality Institute and countless others in the state, which has really made this, I think, a unique opportunity. Rhode Island offers a really interesting area to be able to experiment and learn about how to collaborate in new approaches to delivering health care that I think is not mirrored in a lot of other places. I'd also like to compliment the Office of the Health Insurance Commissioner for really setting and maintaining a climate and environment that allows providers and payers and other stakeholders to be able to talk about these ideas in a very collaborative and effective way. So we've been very encouraged by the enthusiasm and expertise from a clinical perspective that Coastal has brought to our work on payment systems that move toward alternative payments models and away from fee-for-service to improve quality and lower the cost of care. Our initial results have been very encouraging and consistent with what you've seen earlier by Dr. Caros. We currently, Tufts Health Plan has a relatively small footprint in Rhode Island, which makes these sort of financial risk arrangements a little bit challenging to put together. But Coastal has really stepped up to the plate and worked with us to really learn what the best path forward is to how to make these things work. And this willingness, we think, is very important as we continue to work on the state goals of moving more toward alternative payment systems and to better connect the primary care system with the specialists in the hospitals and other types of providers. So we've actually learned a lot from working with Coastal, and they've been a great partner, and we really look forward to continue to collaborate with them and learn what works and continue to experiment.
Yeah. Thank you so much. So I open it up. Does anyone have any questions? Yes. Yes, sir.
How is the CVS Minute Clinics interface with your primary care operation?
Al?
So we've had some meetings with their teams. We see that we see an opportunity there. I think that CVS Minute Clinic is filling an unmet need and we want to make sure that we have the best possible sort of electronic exchange of information when they see a patient. I think we've talked with them also about the fact that they have valuable information for patient care in terms of understanding when does a patient actually go and fill a prescription. That gives us a window into the adherence to taking medication in the way that it's prescribed. I don't know if there's any specific updates that our team would add, because I was in a couple of those meetings, but I think it's still a work in progress. Are there any updates from the front? We're still in pretty early conversation with them. But there's potential there for us to accomplish something good working together.
Other questions? Yes.
Al, can you say something about your plans to work with Medicaid and neighborhood health plans?
Sure.
Sure, absolutely. And so at Coastal, we have about 8,500 Medicaid patients, and a subset of those patients are adult patients of neighborhood health plan. And we've had some discussion that's really a next place of opportunity to be able to take this model that's been successful with our other payer partners and to work with neighborhood in that same way. Lots of potential there.
Questions? Yes, of course, Maya.
What advice would you give to other healthcare providers who want to go down this path?
Buckle up.
It's a little bit of a white knuckle ride. There's no question about that. And some of the pressure points that you alluded to that we would probably see, we've already seen some. There's a lot of uncertainty in this work, right? And there's a lot of change management is a big challenge. Our approach has really been to lead with our values first. Coastal's physician-owned, physician-governed, and so we start with the clinical, right? There is we've been able to build a sustainable new business model to support our transition in this work, but we always start first with sort of looking at what's not yet being met in terms of the needs of the patient. How do we make care more convenient, more effective? And again, getting back to that right care in the right place at the right time. I think something that maybe sets us apart a little bit, we took a very all-in approach. We felt that if we didn't take a multi-payer approach, we would be left in a difficult circumstance of having resources for care that we could only offer to a subset of our patients. So, and that didn't really align with our values and our approach to patient care. The other thing is that I think it's hard to move the needle on total cost of care, so you can't really just stick a toe in the water. So I would say all payer and a fairly aggressive approach are necessary, because otherwise you're just going to incur incremental costs without any impact on total cost of care, and that's not going to be a sustainable situation.
And what we're learning too is that the voice of the patient is so very important, and it's been missing for so long. And I don't know, Dr. Berwick, if you'd like to comment on that, because I know that that's a major part of your work as well.
Yeah, I mean, I think the experience, at least my experience, is that the more power the patients, families, and community have, the better things get. There's a fear that somehow giving control, returning control to the people we serve will somehow uncork demand or lead to unwise choices. That's not what happens. What happens is more sensible, more focused help, and I think you can learn that by demonstrating it. If I could just build on Maya's question.
Go ahead.
I'll say it'd be remiss of me to let this session go without a comment on Senator Whitehouse. Washington is not a very happy place right now, at least when I was there. Government can do so much good, but right now in an era of incivility and inauthenticity, things get lost. You have a senator who I have immense respect for his civility, his intellect, his ability to really talk about the real facts, but we need to arm people who really want to get to the right answer in a very difficult arena with results. Because if people of Senator Whitehouse's competence and stature and ethics can go forward, even in that tough context, and say, look at what can be done, it makes all the difference in the world. So my view is the key here is that you're actually getting the job done. And I can't tell you how grateful I am to you for that, because it just gives those who really want to be the proper kind of change agents the ability to go forward. What you're going to see just in the ACO world, what's going on in healthcare reform right now is, I call it an expedition. It's like there's 50 canoes in the water. They're all trying to get to triple aim, but there's bundle payment and community-based healthcare transitions and medical homes and health homes and you name it, and ACO. So you're part of an armada of canoes. Is that the wrong metaphor? But it matters. It matters. So right now, you'll see in the debate about ACOs, oh, they're not working. Such and such dropped out, or they're losing money. That's not the point. This is an expedition, people, and so one canoe, like yours, that actually does the job and gets results like this, hand it over to a leader of vision and stature, like you've got, and we can possibly really make the case in policy the way it needs to be made.
So, Senator Whitehouse, how can we further support you? How can we give you the information to help you?
I think, we're pretty engaged in what's going on in Rhode Island, so I think it's not so much of getting information to me as continuing to be lead canoes.
Okay.
With both the carrot of being the state that gets it right and has a real deliverable to talk about, and the stick of, if we don't get it right, but somebody in Massachusetts or Connecticut does, guess who they're going to come and poach? Because there's a very big cost differential. And if you get it right and can start eating away at it, that becomes a wipeout. So we really have to, we've got carrot and stick reasons for doing this. I see my job in Washington in this issue as two things. One is trying to mature the conversation about healthcare in Congress away from repeal Obamacare, no don't. Repeal Obamacare, no don't, which is a really dumb level of conversation, but it's where we're stuck right now. But underneath that, there's some tendrils of real conversation happening even in Congress. And the second is to try to make CMS think the way that Don worked so hard to make it to think, which is that it matters more to help the lead canoes than it does to help all the canoes that are muddling around back in the middle. The problem with bureaucracies is that they tend to have as one of their rating phenomena how much complaining they're getting. So if you can shut up the people in the middle by shoveling money and attention to them, you solve that problem. But you don't solve the problem of getting a canoe to the other shore. You don't solve the problem of Kitty Hawk getting that first plane off. That's the goal. And so trying to kind of torture the bureaucracy into supporting not just meaningful use, but real information exchange, not just, tweaks on payment reform, but letting some people really jump free of the payment mechanism. That's kind of been the challenge.
That's fantastic. Other questions? Other questions? We have such a wonderful group. Dr. Hittner?
I actually don't have a question, I have a comment.
Please.
And that is that I want to praise Dr. Carosa and his team who show up at multiple meetings throughout the state of all these different undertakings that we have going on and really contribute. I guess my point is they're not insular, they're not just looking out for coastal, they're looking out how to improve the healthcare delivery system in the state, and I really honor them for that. I want to thank you all for all that put out there.
Well
Thank
said.
you very much. Other questions? I have one more question for the health insurers, and anyone can answer this. What are you hearing from your members about their care in Rhode Island?
I need a second, so.
You need a second? You need a second?
I have a frog in my throat.
Oh, I'm sorry.
Well, I'll go ahead and take that. I think it's been, again, because we have a relatively small footprint, there has not been a lot of comments. I'd say that most of them that we've gotten have been very supportive and positive. There are obviously complaints with insurers. No, we don't do everything perfectly. There are issues and things that come up. I'd say that's more the things that happen to appear are more of structural problems. So there are issues with the way things are designed just because of sort of the somewhat antiquated system. Not so much about their doctors per se or about that sort of thing, but it's more of I can't seem to get this thing done, and I don't know why, because I think a lot of it's around the coordination. That seems to be the biggest thing, I would say.
Yeah, I think that Rhode Island is the perfect laboratory for this work, first of all. And I think patients today are kind of at a transition point too. I think they because of the fragmented nature of the delivery system, there's not a experience you can ask them about because their experience is very unique every time because the system is so fractured. I think increasingly what we see our patients saying is when they go to places like Coastal, frankly, they starting to feel a difference. That they understand this notion of what patient-centered means, and that they are in the center, and the system works around them and for them. And I think as these systems, like Coastal, and as Coastal becomes part of other larger systems, as we talked about before, of hospitals and subspecialties and so forth, that where the larger system works around the patient too, the patients are going to be astounded. They're going to be thrilled. They're going to say, wow, what a difference this is than what I've had before. So I think, we're starting to see patients being able to differentiate, which is a really good thing. And I think as, there's going to be great advantages to places like Coastal, and Al and I talk about this all the time. These emerging systems of care are going to have a huge advantage because that patient experience, especially in a time when we're going towards more of a consumer, consumers are going to be purchasers instead of employers. It's going to matter a lot, and those systems are going to have a real advantage.
So,
Jenny?
if I can speak.
Yes.
I'd like to take a second to recognize a particular initiative that Coastal has implemented, and that is your Medicare Wellness Center. So from a patient experience perspective, having been there and visited it myself, I know that's a differentiator in the way that your patients are interacting with you. And they're being viewed as the whole person, and it's not just a regular or primary care visit. So I'd say that program is exceptional, and I'd like to recognize that today.
Yeah, thank you. Well, I'd like to, oh, yes, I'm sorry. Go ahead. I think we have time for one more question.
I want to thank Coastal. I'm a patient there.
Of course.
Myers saved my life 3 years ago after hospitalization in Berwick. And I got to learn about Coastal over that period of time. And it began to be a neighbor of mine. And I wanted to announce that we're going to kick off in January something called Get Healthy America. As a subset of that is going to be Get Healthy Rhode Island. It's a new look and approach that complements what you do in a way that looks at smoking cessation, exercise, and also nutrition as elements that have to be presented in an educational format from day one, from
Yeah, thank you so much, and thank you, everyone. You know, I've been at Coastal for 16 years, and I look in the audience and I think how many partners that we have here, how many people we have worked with, you know, week upon week, and worked through the tough times, and we're really all in this together. And it's been such an honor to be here today, and to have Al speak, and to have the Senator join us, and to Dr. Berwick to join us, and travel down to see us, and have, you know, these outstanding leaders of our health insurance industry in Rhode Island. We're all very lucky, so thank you very much.